I saw someone with maggots on their body. What? Why? A new fear unlocked. Maggots on the body, regenerating limbs, and is wearing socks dangerous for your health? Huh? Today I'm breaking down and answering medical questions that some may just be too afraid to ask. Brace yourselves, this convo might get a little out there. All right, let's dive right in. First question, why do my feet have a strong odor even though I have good hygiene, and how can I treat this best? Well, it's because it's dark, it's moist, it's wet down there, and it's a very good environment for bacterial overgrowth as well as fungus. So you want to make sure that your feet are dry, you air out your shoes, make sure you have clean socks on, because basically the bacteria is what ends up making the smell. And if you're having a major issue, obviously have a discussion with your primary care doctor. I have asthma, and I was wondering, why is it that my lungs feel like they are burning in winter? Does it happen in the cold to normal people as well? Or is it only to those who have asthma or another type of breathing condition? Also, why is it that it feels like my lungs are burning from cold air? So asthma is a inflammatory disease going on in your lungs where there's excess mucus, there's inflammation, there's difficulty breathing, and ways to treat it are inhaled medications that you would take on a daily basis. So you really want to minimize things that might irritate your lungs. And unfortunately, the cold is one of those. It's what you could potentially do if you live in an area where there's a lot of cold air. You want to warm up the air before it's going into your lungs. How do you do that? Maybe wear a scarf or like some type of fabric over your mouth, so that way you breathe that in, it warms it up a little bit. But that's why we have a nose. Our nose is actually designed to warm up the air, cause some humidification to it, and that way it's easier for our lungs to handle. Why can't humans regenerate limbs like other animals can? What is the biological basis for regeneration in animals like salamanders, and could humans ever harness similar capabilities?
Am I crazy? Or is your hand really small?
Well, salamanders can have things where they regrow, like limbs when they get destroyed, and it just has to do with their genetic makeup that we just don't have. They have these cells that are very similar to our stem cells, but what ends up happening is these cells can differentiate into anything. So depending on what the body needs and getting information from the body, these cells can then make them needed cells. Unfortunately, we don't have the ability to harness that many stem cells. As for the salamander, they got one up on us. We can't regrow limbs yet. But the only thing that we have in our body that is, kind of cool like that would be our liver. Our liver has the ability to regenerate and regrow. So you can't just regrow a liver from nothing. It does need the cells that are already there to help regrow, but as long as the liver tissue itself is not damaged like cirrhosis, you'll be able to regrow your tissue. Any salamander experts out there, let me know what your thoughts are in the comments. My cousin gets a lot of reoccurring nose bleeding. He is an adult. Could he have any underlying other cause that would be going on? Should my family be worried?
I got a nosebleed and I don't work here.
Well, nosebleeds could be related to picking the nose, could be air quality, could be dryness of the air. Those are some reasons why somebody would have a nosebleed. But again, if you're having recurrent nosebleeds, you can look at the turbinates, which is the tissue within the nose, that maybe you have really bad allergies and the tissue is really frail. Sometimes I suggest people to use nasal sprays, basically to help lubricate. But again, definitely have an ENT take a look at this area, because they're the specialists, they know what they're doing, and they can help if there's something easily identifiable. Next question. Sorry, TMI, but why does my poop look hairy?
That's not the only thing we gotta get working again, if you know what I mean.
Actually, you're eating a lot of fiber, most likely, like green leafy vegetables and other fruits. But yes, very interesting. And then obviously, if we need to, we can take some poop samples to be able to test. We're looking for infections. But I highly advise continue to have a high fiber diet. If it's a hairy poop that you have, it's okay. I have, prior to this video, made a poop color, like what your poop should look like. Definitely check that out. We'll put it in the description below. Is gonorrhea becoming resistant to antibiotics? And if so, what does this mean for the future of STI treatments and humanity? Gonorrhea is becoming resistant to our antibiotics. And do you know why? It's because we use a lot of them. Gonorrhea is also called Neisseria gonorrhea, and it's a bacteria that is sexually transmitted that you can bounce back and forth between different partners. It spreads, and it basically is characterized by potentially fevers, purulent discharge, and it's uncomfortable and painful. Practice safe sex, as well as if you do have these symptoms, go to your doctor, get treated, very simple antibiotics, and then if they culture it and they find that it's resistant, typically they will adjust the antibiotic for you or change it up. Are energy drinks bad for your body? What's worse, that or coffee? Typically a cup of coffee is around 100 milligrams of caffeine versus an energy drink could have anywhere between 100 to 400 milligrams of caffeine plus whatever other ingredients that manufacturer wanted to put in there. And the daily maximum recommended dose of caffeine really doesn't go anywhere above 400 milligrams, and even that is high. So I see people come to the emergency department quite often with tachycardia, arrhythmias, anxiety due to increased amount of caffeine. That is why I created Level Up. Everything that we have in this product right here, check it out, Level Up, is an ingredient that you know what's in there, the exact amount of milligrams, and basically this is for energy and focus. I use this before I go to my shifts, especially on night shifts. If someone is in a coma, how does the body work without any food or water?
You've been in a coma for almost 2 decades.
That doesn't sound right.
When somebody's in a coma and they're not eating, we provide artificial hydration and nutrition. Artificial meaning people are getting the IVs in the arm or their neck or their groin, depending on how sick they are. And we're providing fluid, so we use normal saline. And there's something called TPN, total parental nutrition, and it gives nutrients into the body. And if you're in a prolonged coma, you're likely going to end up getting a feeding tube, only because we want your gut to work, absorbs the nutrients, uses your body, absorbs the fluids. So that's how we take care of coma patients. Good afternoon. If a catheter is inserted incorrectly into a person, causing terrible pain, thereby preventing the person from completing the ejaculation cycle, could this deprive them of the opportunity to make a child? Foley catheter is a tube that you place through the urethra to go into the bladder. And for a male, it passes through the prostate into the bladder. But remember, your sperm hang out in your testes. So likelihood that that process has been interfered with due to a Foley catheter is probably pretty low. But if there's enough trauma that prevents you from having an erection, then yes, definitely talk to your healthcare provider, maybe even talk to a urologist, and see if there's something that can be done. I suffer from extreme head sweating, apparently for no reason. Is there any surgery to end this suffering? And yes, there are options out there. Botox, aka botulinum neurotoxin. This can be used to reduce the amount of sweating that you have. But why do you sweat? There's something called primary hyperhidrosis. Other things are diabetes, thyroid, fevers, right? And obviously, if somebody is very nervous and you have anxiety. Next one. I'm a newbie in the medical field. I saw someone with maggots on their body. What? Why? A new fear unlocked. They're eating dead tissue, festering for so long that it didn't seek medical care, that these maggots and larvae were able to grow and reproduce on this tissue and eat it. It's a very unhygienic situation that the individual's in. So we definitely try to remove them and help the individual to a better path of healing. Typically wound care, possible antibiotics, just depend. Not an ideal situation, but I do know that we get rid of the maggots when we see an individual come to the emergency department and we treat them with modern medicine. Number 12, why can't we remember being babies? What happens in our brains that makes early childhood memories inaccessible to us as we grow older? There's something called infantile amnesia, basically the inability to have memories, especially in our infant state. So our brain are developing during those times, so it doesn't allow us to formulate long-term memories in that case that we can then access. And it's all because of the hippocampus. And so a very important part of our brain having to do with memories, it's still maturing and still learning. So what is your earliest memory? I want to know in the comments. Weird question here. If someone swallowed a bag of popcorn kernels and then had an MRI, would the kernels pop due to the heat generated by the machine? Probably not. So MRI is the magnetic resonance imaging. So it is not microwave. So we know microwaves generate heat, but MRIs, they're not generating that type of heat. No. And keep in mind, obviously, an MRI and metal do not get along. Number 14, have you seen the new Fallout TV show? If so, is it true you could live without your nose? Just like a hole in your face. So I just did a react video to Fallout, so definitely check that out. And yeah, in Fallout, the guy's missing the soft part. Whoop. of his nose. He's not missing the bone part, and he's still having the internal structures of the nose itself. So the point of the nose is actually to help just humidify, filter out, warm up the air that you're breathing in. Why might people not have that soft tissue of their nose? There's different infections, leprosy, excess cocaine use. So there are many different reasons why somebody might have this. Is it true you go bald if you have too much testosterone in your body? I'm kind of young to be losing my hair, but here we are. All right, so high levels of dihydrotestosterone, DHT, is associated with hair loss, especially for those who are predisposed to have male pattern balding. But having high levels of testosterone doesn't guarantee you have no hair on your head. There are a lot of other reasons why somebody might be balding. Could just be genetics in general, could be alopecia, could be thyroid disease, could be diabetes, could be infections. Again, one size does not fit all, so definitely get things checked out if you're starting to lose hair. Next question, if genes control enzyme production, could we alter genes to create super enzymes that prevent diseases? What are the potential benefits and risks of gene editing for enhancing human health? Enzymes are types of proteins relating to, transport, cells, walls, structurals, literally everything, okay? So too much of an enzyme or too little of an enzyme can cause health problems. It's always about balance, and we are made the way that we're supposed to be made. So when we have a deficiency, then yes, having the ability to have gene editing to improve that enzyme is probably something that would be cool. And I think there's a lot of research that still needs to happen. I think it does have an important role in, health and medicine in the future. Is wearing socks to bed dangerous? Well, it's not necessarily dangerous, but you also don't want the socks on all the time. You need your feet to air out, dry, and not be sweaty and wet. That's one component. But then also socks can decrease circulation to your feet, so you want to make sure you're not wearing socks that are too tight. And then if the socks are appropriate, they can actually help improve circulation. Are you guys out there sock wearers when you go to sleep? Let me know in the comments. Wow, these questions this week were fantastic. I liked it. I want more. Let's keep talking about it. If you guys enjoyed this, definitely continue. Send me more and more questions. I will answer them. And if you guys enjoyed this, definitely binge watch this playlist. And as always, please make sure you subscribe. Turn on those bell notifications and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.